peer PD. That is a very interesting. We put together a workshop because we noted that there were several patients who had Parkinson's disease, and we wanted to make sure they were aware of what we call non-motor features of Parkinson's disease. These can include problems with sleeping, mood disorders, and other things of that nature. So what this, it was the mnemonic, but participants united through retention and education. So our focus again was looking at Parkinson's non-motor symptoms, and there were 3 workshops that were put together, one for exercise, one for nutrition, and one for mental health. And just to talk about the importance of some of these other factors that could impact or potentially worsen or affect your non-motor symptoms in Parkinson's disease. Each workshop was completed over an hour and a half, 90 minutes, 90 to 120 minutes, depending on how long the discussion after went. And the last workshop, particularly the workshop on nutrition, was combined with understanding how to cook various different meals. So they had a kitchen simulator and they went over different meals, what to cook, and they were provided with opportunities to cook their own meals as well. Overall, in general, the feedback was very positive. People seemed very excited about learning how mental health can impact your disease as with Parkinson's disease and the progression of that disease. They wanted more information, and they thought that additional workshops would be helpful in the future. And we look to kind of generalize this and open this up to more people within the community and to make it a little bit easier for people to get to. And so we're trying to find different ways to do that as well.